Hello, my name is Jorge Espinosa. My topic about is Belatacept and Long-Term outcome in kidney transplantation. Definition. Belatacept is a selective co-stimulator looker that has been developed in improved long-term results in kidney transplant recipients by providing effective immunosuppression without the toxic effect of calcineus inhibitors.
The use of immunosuppressive therapies in patients with kidney transplants has reduced the incidence of allograft rejection. The current standard of care immunosuppressive therapy includes calcineurin inhibitors, such as cyclosporin, plus anti-proliferative drugs, with or without maintenance glucocorticoids. However, calcineurin inhibitor-based regimens may not adequately preserve allograft function. In this 7-year extension of a previously published 3-year randomized trial, investigators compared the ability of Belatacept and cyclosporin to preserve allograft survival and function. Belatacept is a fusion protein composed of the Fc fragment of human IgG1 linked to the extracellular domain of CTLA4.
Application in nursing. Current standard immunosuppressive regimen combines calcineus inhibitors with anti-proliferation drug without maintains glucocorticoids. However, calcineus inhibitor-based regimen might not adequately preserve allograft function, leading to deterioration of kidney function, which is a risk factor for cardiovascular death in kidney transplant recipients. Pros and cons. Pros. Belatacept is appropriate for use only patients who are positive for Epstein-Barr virus, having the increasing rate of post-transplant lipoproliferation disorder, rise predominantly affect the central nervous system. Patients randomized to a more or less intensive rehabilitation regimen has a 43% reduction in the risk of death or grass loss at 7 years. Cons. The most notable consequence was the car observed in Belatacept is that although it has a very long-term effective and prevents the appearance of adverse effect in the quality and between of the medication. It is not 100% certain what the adverse effect will not appear. with time. Using applied in Ecuador. According to internationally 44 hospitals are accredited to perform transplant. The different programs available are kidney transplant, liver transplant, cornea transplant, heart transplant, lung transplant, osteomuscular ligaments tissue transplant, histocompatibility and immunogenetic laboratory, tissue storage, cell banks, and hematopoietic progenitors.
For me, it was a shock because I was perfectly healthy on Tuesday. On Wednesday, I was short of breath. Went to the doctor thinking I had bronchitis, pneumonia, something, and it turned out to be I wasn't. My lungs were shutting down. They could get my lungs back, thank goodness, but they could never get my kidneys to come back. Going through dialysis keeps you alive, and I'll always say that, but it is not a comfortable way to live. You're very, very restricted on what you can drink, eat. And my doctor was really, really supportive of knowing my personality that I would do much better if I could get the transplant. All of a sudden, your life is back. Maybe not quite as normal as it was before, but it's just like a miracle that can't describe it, how the feeling is. They approached me with it and explained what the study was and why they were trying to have people enter into the study. And at that point I thought, well, if it'll help somebody else down the road, I'll be my, hero self and I'll do it.
The Emory Transplant Center was very involved in the development of the whole class of drugs that Belatacept fits into.
The average lifespan of a deceased donor transplant, the most common type would only be 8 to 12 years. But if you're a young person coming to transplant, that means you're looking at potentially needing 2 or 3 transplants for a normal lifespan. So Belatacept offers the first alternative to the cyclosporin type drugs that have been the mainstay actually for nearly 20 years. They offer an alternative that looks like it achieves the good short-term outcomes that we wanted to maintain, but it preserves kidney function and reduces cardiovascular side effects as well. The problem is that the transplants just don't last as long as we'd like them to. The way your body rejects an organ, a transplant, is it recognizes it as foreign. Now that's a good thing in the case of a virus. You want your body to respond to a virus. In the case of a transplant, that's not what we want, and we want to control the immune system. The way the immune system gets activated is first it gets a recognition signal. It says, oh, this is foreign, and it starts a response. But it also needs a second signal, a second set of interactions to occur, and that's called co-stimulation. And Belatacept blocks that second signal, that co-stimulation signal, so that the transplant is recognized as foreign, but that go signal, the co-stimulation signal, is blocked.
The Bela infusions are great. You get an IV. Once that's done, you just sit. And so it's really a easy process. There's really nothing to it.
I think for many patients, Belatacept may be an improved quality of life in addition to hopefully an improved survival of their transplanted organ.
My customers always ask me where I had my transplant, and I always tell them Emory, and I always tell them I had such a good experience that I think their staff here, and with all the innovations that have come to Emory, to be able to do some of the things that they've been able to do, I think it's just an exciting time. And then after the transplant, it just gives you your life back. It's just like a miracle that you can't describe it, how the feeling is. It's just a wonderful experience.